Hello, I am your Resto, Midshipmen Alcorn. Today we're going to be going over the EMT refresher for everyone who's either come back from sea or come back from a 4-month-long Zoom University vacation. All right, let's get started. The purpose of today's lecture is to review all the duties and responsibilities of the watch team, make sure everyone's comfortable and capable of performing their duties, and to make sure everyone's safe and sound while taking patients in and out of campus. The watch team members. Starting from the bottom, or the tip of the spear, is the technician. A technician is the right-hand man of the crew chief, or the manpower. They assist with patient care, be that vital signs, temperature, SpO2. They can write things on the PCR, help with angry COs or people on call. Not just along for the ride. That's important to make sure everyone's really working hard on the call. And they double check the crew chief. Now, the technicians are usually the second or third classmen, and they are closer to EMT school than us first classmen. So it'll be nice if third classman says, "Hey, man, you should probably write that on the PCR." The driver's responsibility is to get everyone, the patient and the watch team, from the call to the hospital with no accidents. Generally know the route. You can go over it really quickly. Grab the pen option. So you're going to start at Kings Point here. You're going to go down Steamboat Road. Take a right on Hicks Lane. Make that Middle Neck Road. Take a right on Middle Neck. Take a left on Hicks Lane. And then follow the bend around to East Shore Road. There should be no break in that. And from the PowerPoint here, there's been some construction, and it's a busy intersection. So just look out for that. Be careful. If it's a busy intersection, maybe turn off your lights and sirens if you are lights and sirens. And then follow it all the way to the ambulance entrance here. They generally provide manpower. They can help with carrying the O2 trauma bag. They can carry the Reeves, scoop, and stair chair up to the call. And they prepare the ambulance right now because it's hot. There's going to be probably some heat stroke, heat exhaustion related cases in the near future. But just make sure that the ambulance is always in the right environment and that the master switch is on for both inside and out of the bus. As for the crew chief is responsible for the safety of the watch team, the driver, the patient, and all the patient care reports. Also communicate with Vigilant. That's very important to make sure that if the crew chief is not if the crew chief is not specifically saying 21, 22, 21H, 22H, that he is making sure the driver is saying that on the Great Neck Vigilant radio system. And just making sure Patton knows, Medcom knows, and everybody knows what's going on. The crew chief's name goes in the in charge slot in the PCR, so if any legal things come up, that's the person that they're going to ask what the heck happened there. And they're in charge of saying what the situation of the patient is, if they're going to be load and go, stay and play, RMA, how's it going to play out? And general patient movements, how they're going to get from the scene to the bus to the hospital. And if you do an ALS intercept or just a general RMA, the protocols for that. Duties of the OIC. The OIC will be manned by myself, the other EMS watchstanders, and some first classmen that will help us fill the role of OIC, which is the overall scene commander. We're not trying to be overbearing or step on the toes of the crew chiefs, technicians, and drivers. We really just want to make sure you guys have the best possible environment to get a safe and efficient call. So if that's stand on the sidelines, call Vigilant, making sure you guys are all good, the bus is in place, that's what we're going to do. We're not